Doctor, how does stress affect men and women?
Stress is a major parameter which actually affects the reproductive health in both men and women. Unfortunately, there is no parameter to check how much is the stress in individuals. We cannot quantify it. But however, we all know when we are stressed and we tend to not function in a proper way. So in men, if they are stressed over prolonged periods, there's a hormone called as cortisol which gets triggered, and cortisol in turn seems to be affecting the reproductive function in a bad way. So it leads to hormone disruption, and this hormone disruption in fact leads to all changes in the parameters of the semen. The sperm morphology, the sperm count, everything tends to go for a toss. This leads to infertility. Similarly, also stress does affect the production of testosterone. And because testosterone levels go down, there is sexual dysfunction. All these things further complicate fertility. In women, stress seems to be having an effect on the pituitary gonadal axis. There's something called as hypothalamo-pituitary gonadal axis, which helps in maintaining a hormone balance in women. If you see, the menstrual cycle is a cyclical rhythm. So there is egg formation, then if there's no pregnancy, the egg undergoes a degradation, and then there is menses. Now, this cyclical rhythm tends to be disrupted when a lady is stressed. And because of the disruption of the cyclical rhythm of the ovulation, there is also imbalance of hormones. And this imbalance of hormones leads to something called as anovulation. That means either the egg doesn't generate, doesn't mature, doesn't release correctly, or is produced in a delayed form, leading to prolonged menses or no menses at all. So all these things which affect the menstrual rhythm can be a cause for infertility and fertility matters. Stress also leads to overeating, depression, a feeling of low, and all these things actually can have an indirect effect in a way that a person may not maintain a healthy lifestyle.